actually, I want to say very important thing to you, and hopefully everyone can understand from this area very easily. And what I say to the patient is, central most 6 centimeter on back of the head is considered to be a permanent area at any age. I would say that this area from here to there is considered to be safe area, and most safe area among this is this central part, you see. And you can make it very simple. You see 10-15 patients who are totally bald and at age of 80 or 70, you see the baldness comes down from up and goes up from down, and you see this is strip on back of the head to every 80-year person who is totally bald. So this area is considered to be most permanent area at the age of 80. So why don't you take these hair and put in front, so that they should remain there till age 80 forever. So considering this point, this is very important to identify the most permanent hair on back of the head at any age. So we cannot take hair, you see thinning is coming down at this age. Even he is only 26, and you see thinning is up to this area. And if in case of FUE, I have drawn these lines for FUE area, we take one graft from this area. What would happen if we are taking graft from this area and putting in front of the hair in the recipient area? If the thinning comes to this area, what would happen? If the hair fall from this area, they will fall from this area as well. So there should be no intention in putting semi-permanent or non-permanent hair in the recipient area at any age. So whenever you are considering hair transplant in very younger ages, less than 30 mostly, you should be considering the most permanent hair to be transplanted in the front, so that they should remain there forever until the age of 80. So, and second thing that is more important than this particular patient is having 100 follicular unit per centimeter square in this area, very good density. So we can take a very good number from this step. If we can calculate this step, I draw this step like crescent shape, so that length of this step should be increased, not width of this step, because width, actually we put the width on elasticity available on the back of the head. So because we want to have a good closure as well at the end of this strip harvesting. So in strip harvesting, it is very tricky to decide the width and length of the strip. This is more important. Length can be increased from this level to this level, remaining in the frame of permanent area, and width can be increased on depending on the elasticity available on back of the head. So I have not increased the width of the strip, I have increased the length of the strip, and we can easily excise more than 4,000 grafts from this smaller area, in this smaller strip area, and whole area will be available for us for second session. So FUE, putting FUE in this scenario is to add up more hair in the future. it is not like I'm biased about FUE and FUT procedure. It should not be decided on my wish and on the wish of the patient. It should be decided on the scenario available, because we want to put most permanent hair at any age. So he is a very young boy, 26 only. If we are intending to do hair transplant to him, we should be considering only one thing, that we should be putting transferring the most permanent hair from back of the head to the to the recipient area, so that they should remain there forever. And in young patients, I'm intending to do a very good density in the frontal area. That's why I'm taking a good amount of hair to give density in the frontal area, so that he should be comfortable for many years. And one thing more very important than this is, we will go for medical treatment as well, because if we are not doing medical treatment, this area will keep increasing, and he will be bald in this area. As you see, thinning is already here in the crown area, and it can extend downward to this area and in the frontal area. So we need to prevent hair fall in future coming years, so that I'm not intending to do a second surgery to him before 40. So we should be going to tell him, we should explain to the patient that he will be taking medicines for 2 years at least now, and 2 years after 36 or reaching 36, so that he should be entering into 40s with good amount of hair, existing hair. And that is the actual success. And surgery in hair transplant could never be successful without medical treatment, because this is androgenetic alopecia. If it starts in early 20s, it will keep increasing in the coming ages. So we should take care of the existing hair as well while we are planning hair transplant surgery in early ages. So I have explained you that from very small area we can excise a good amount of hair, more than 4,000. While if we are doing FUE in this age, we will be doing the whole area to excise 4,000 grafts. So why don't you excise a very little area and can get a very good amount of permanent hair, who they will remain there until 80s and 70s and so on. This is my point. So while you are a hair restoration surgeon, you need to learn both procedures, FUE and FUT as well, with good expertise. Because I saw so many things that if one patient came to me in last week, and he was transplanted in FUE at the age of 28, and I saw only few here in the frontal area. I asked him, how many grafts you were excised from this area? He said 2,500. But when I trimmed this area, it looked that whole area was ruined. And when I calculated the excised grafts, the number went more than 7,500. So they put only 2,500 in the frontal area and wasted 5,000 more grafts in the donor area. So experts should be there. If you are going for hair transplant surgery, why don't you look for experts, so that they should be having a good knowledge to decide a good procedure for you. The best thing is best thing always. Why do you compromise on these things only for money, and waste a precious donor area which cannot be bought, which cannot be purchased in hundreds of thousands after when you get it wasted. Thank you very much.